For a third dose of its COVID-19 vaccine. Right now, U.S. health officials say a booster shot is not needed just yet. But Pfizer says early data from a recent trial says people's antibody tests jump after they get a third dose. Health educator Dr. Griggs is here with some perspective. Dr. Griggs, I guess kind of break down what it was that Pfizer saw in that trial with the third dose being administered to the people in the trial.
Well, it's still kind of theoretical in a sense that they noticed that, of course, that your immune response went up after the second dose, and then they noticed 6 months out that the protection seemed to wane after 6 months. So they're thinking that a third dose might be even more protective. The issue is that we don't have everyone vaccinated with the first two yet, and that's kind of the pushback, is that can we focus on getting everyone vaccinated so we won't have to worry about variants?
Right.
And then we might not need a third dose. We just want to get everybody protected.
So that's still the push from the health community, and that's where we don't need the third dose comes in from the medical community right now?
Right, that's exactly where it is. It's like we're not at herd immunity, and there are countries outside of the U.S., there are other countries that don't have enough vaccine. So if we can work on getting people vaccinated the first time, and then we'll worry about it, and give it a little time to see exactly what would be what variant might be needed in the booster. I mean, we just talked about Lambda yesterday, and we don't know what's down the line. So it's an interesting discussion, and again, we're taking back the window of science and public health, and you're seeing what happens in the research world.
And it's just a lot of back and forth and questions being asked and trial and error. That's pretty much how we've been seeing it happen for the past 15 months.
Yeah, exactly what's happening.
And you mentioned the other countries outside of the U.S. kind of dealing with a vaccine shortage, if you will. I mentioned to you Australia. I heard a report where they are increasing COVID restrictions because they're seeing a spike, what they deem a spike in cases, and because they're also not getting enough people vaccinated. They have the AstraZeneca and Pfizer vaccine. Right. AstraZeneca is only for 60 and up, and then Pfizer for 60, I guess 59 and under. But they still can't get enough of the Pfizer vaccine. So again, this just goes to that point you made about America and other countries are trying to work to herd immunity before they can even discuss getting additional shots or boosters, if you will.
Which brings up the social science of things. We can't get people, I mean, we got an awesome song now to try to get people vaccinated, but there are some people on principle that just refuse to do it. And all the numbers are showing, Dr. Cantor alluded to it earlier, 99% of the people that are being hospitalized are unvaccinated. So if we can convince people to just go ahead and get through the first series of vaccinations, be it a 1-shot or a 2-shot, we might not have to worry as much about a booster right now. Eventually we probably will need one, but can we just get vaccinated? I think that's the issue.
Doc Griggs, you and I have talked now twice this week about the variants, about things happening with these studies on the possible booster. We have this song out. I mean, kind of everything happening to try to convince people to get their shots. You have a couple seconds here right now. If you could tell people at home, or a whole minute I'm being told, if you could tell people at home right now who are on I am not getting a shot on principle, or I just don't feel comfortable, what would you tell them to make them comfortable enough to just say, okay, I'm gonna get that shot?
If you look at the numbers, all of the people, the majority of the people that are being diagnosed as positive, that are being hospitalized, and that are dying are the unvaccinated. Come to the bright side. It's not bad over here. Just let's get vaccinated so we can be done with this for good.
It's been a while since you got your vaccines live on air, so if you can just remind people the side effects that you experienced, again, to help ease people's fears or concerns.
Yeah, so I was very honest about it. I was fatigued, I had the chills, I had a mild headache, the fatigue lasted, and all this was like for a couple of hours, and I was fatigued for a few days. After sleep and water, I was fine. I thought it'd make me taller, but it didn't. Maybe I need a booster, right?
With the jokes, Dr. Griggs. Well, we appreciate your time, and again, just the importance of getting people vaccinated, because if we get more people vaccinated, as you're saying, we may not even have to have the discussion about boosters.
Yes.
All right. Well, thank you so much. We appreciate your time.